All right, so good afternoon. Thank you very much for being an amazing audience so far. My name is Stefano Zaccagnini, and I am a third-year PhD candidate at Flinders University, with my PhD being co-funded by the Alcohol and Drug Foundation. So that's my first acknowledgement. My second lot of acknowledgements go out to my supervisory panel, namely Professor Jacqueline Bowden, Dr. Ashley Bartram, Professor James Smith, Associate Professor Michael Livingston from Curtin University, and Dr. Natalie Bavopoulos from the Alcohol and Drug Foundation. One final acknowledgement will go out to the Australian Institute of Health and Welfare and the Australian Institute of Family Studies for allowing me to use of their data sets. So today I'm going to be speaking to you about the first half of my PhD, so namely the first two studies, which looks to identify who the Australian midlife men are that engage in risky drinking that exceeds national guideline recommendations. So just a quick background, alcohol is linked with over 200 harms to health, attributing to approximately 2.6 million deaths globally each year, and is linked to various short-term and long-term effects to health and well-being. So by short-term health, I refer to just hangovers, and by long-term health, I mean issues to the liver, potential cardiovascular issues, and even 7 types of cancers, including areas of liver, stomach, and throat. So alcohol is identified as the most accessible recreational and legal drug, though many do not perceive it as such or recognise alcohol as a typical drug when compared to other substances. And among that, men show greater prevalence in alcohol consumption, along with the accompanying risks and harms associated with alcohol when compared to women. So going into Australia specifically, alcohol consumption is a widely accepted practice among a variety of social contexts, typically acting as a social lubricant. Revisions of Australian alcohol guidelines continue to be revised to reduce the harms associated with alcohol. And as mentioned a few times already in this session, the guidelines are to drink no more than 10 standard drinks per week or more than 4 standard drinks per occasion, though continue to recommend drinking less to reduce the risks of these harms. Currently, Australia is observing a continued declining trend in risky drinking among Australian men specifically, though this is a result of predominantly younger cohorts. Midlife, on the other hand, are often overlooked in research, despite being the age group that is more likely to engage in frequent and routinized drinking across the week. So, my PhD's objectives are to identify the factors associated with risky drinking among midlife men by using Australian national data sets provided by the two areas that I've recommended earlier, to explore a population subset from the previous aim, midlife men's perspectives or experiences around risky drinking, such as the self-identified motivators and characteristics, and to explore the understandings and behaviours of this subset of midlife men around help seeking for personal alcohol use. So this includes the barriers and facilitators to accessing treatment. Today, my first two studies will be looking at that first aim more specifically. So let's talk about that first study, which is a quantitative analysis of the National Drug Strategy Household Strategy Survey, or NDSHS for short, which this study was only just published last month and received a fair bit of media attention. So this study was the first step into identifying who the Australian midlife men are that engage in risky drinking and the factors that are associated with such. So logistic regressions were conducted in the analysis in order to analyse the midlife men and risky drinking. So just going to overview the key findings from this study. So approximately 42.9% of Australian midlife men who were aged 30 to 59 years in my study, sorry to most of you in the crowd, consumed alcohol at levels that exceeded Australian alcohol guidelines, which equates to approximately 2.2 million men in Australia. Various factors were significantly associated with risky drinking, which were, again, identified via the logistic regression analyses. These included the co-use of smoking tobacco products and or illicit or unprescribed medications, men who lived in rural and remote locations, men who earned household incomes exceeding $2,000 per week, men who worked in tech and trade occupations or worked in managerial positions of occupations, men who were previously married, and men who had either not completed secondary schooling or had completed a peak of tertiary or diploma. When I also compared the two stages of midlife, younger middle adults who were aged 30 to 44 years and older middle adults who were aged 45 to 59 years, two of the factors we explored produced significant findings. Marital status for older middle adults was a significant protective factor for those who were single and never married, whereas there was no difference in the younger middle adult group for this factor. And higher self-reported psychological distress scores for younger middle adult men, but not for older middle adult men. But overall, this study contributed to a national public health interest, highlighting various factors associated with risky drinking among Australian midlife men. But this was only the first part of the story, as this was a cross-sectional data set and we wanted to know more. So let's do it with a longitudinal data set. So study 2 was a quantitative analysis of the 10 to Men longitudinal study of male health, with a running title being Predictors of Changing Patterns in Alcohol Consumption Among Australian Men in Midlife, an examination of a national longitudinal cohort. So while this study also looked to identify the factors associated with midlife men from a longitudinal perspective, this study also looked for risky drinking with changes over time. So using the 10 to Men longitudinal study of male health, this study utilised two waves. The first wave being conducted in 2013 and the fourth wave which was conducted in 2022, which is how far we wanted to examine these changes. And we wanted to identify the factors associated with stable high-risk drinking over time among emerging and currently midlife-aged men, which was 25 to 44 years at baseline. And I understand I'm getting younger with midlife, so again, do not feel old, you're all young at heart. There were 34 to 43 years by the final wave. And factors associated with transitioning from low-risk drinking at wave 1 to high-risk drinking wave 4 over time among midlife men. Unlike study 1, which utilised the national guidelines, this study implemented the alcohol use disorder identification test and specifically the consumption questions, which were the first 3 questions of the 10-question scale. These questions asked about the consumption, including drinking per week and drinking throughout each drinking occasion. And each of these questions had a range scoring of 0 to 4 for a maximum score of 12, where scoring 0 meant never or very low amounts and 4 meant high amounts. Risk groups were then determined based on a scoring range of 0 to 4, which was considered as low risk, and 5 to 12, which was considered as high risk, and they were both examined across waves 1 and 4 to determine transition groups. We then included samples that also responded to all of the factors of interest at wave 1. So what did we find in this one? Well, overall, we found that high-risk drinking declined by 4.3% between waves 1 and 4, and predominantly majority of the midlife men included in our sample were either stable high-risk drinkers or stable low-risk drinkers over time. So to examine the factors associated with stable high-risk drinking, a number of factors came out, some similar to that of study 1 and others a bit different. So currently smoking and using any drugs in the last 12 months, so the co-use factor stayed the same. Residing in rural and remote areas stayed the same. Higher household income stayed the same. We found that working in unskilled occupations, including sales and labourers, was significant in this study, but not in study 1, which was also quite an interesting find, as well as fathers of independent children or children over the age of 18, also being significant with stable high-risk drinking. We also wanted to explore significant factors associated with transitioning from low risk to high risk drinking, to which 3 stood out. Being married and in a relationship was significant with changing your drinking patterns over time, as well as working in a skilled occupation such as a clerical, administrative, or personal and community care work, and fathers of dependent children, particularly with men aged 25 to 34 at baseline. So overall, what does this mean? Well, this is a synthesis of both the studies, a very, very messy table, but does hold some very, very interesting stories. So similarities including the co-use of smoking, illicit drug use, living in rural and remote locations, and tech and trade occupations stood out across both studies. But there were some interesting factors that were highlighted, particularly between me and my supervisory group, which would then lead into the second stage of my PhD studies. And that is, who are the midlife men that we do want to look into understanding why they drink? And there were 3 factors in particular that stood out to us the most. Men who worked in tech and trades, fathers of independent children, either independent or dependent, and men with, who lived in rural and remote locations. So overall, we did unanimously decide between myself, my supervisory panel, and the Alcohol and Drug Foundation that midlife, rural and remote fatherhood would be the most appropriate focus due to both gaps in research and the impact we would have on a health equity standpoint. This will be a qualitative design with semi-structured interviews with hopefully recruiting around 20 men fitting the demographic. And recruitment will be occurring in particular spots such as men's sheds and other community sporting groups. These are just early ideas for the study, just by the way. But the early objectives of this study is to identify the motivators and characteristics of rural and remote fathers and their engagement with alcohol consumption, contributing to literature for both population health and health equity, to explore the potential barriers to treatment that may explain why midlife, rural and remote fathers may not be seeking help for suspected or known risky alcohol consumption, and to investigate the potential facilitators for help-seeking and support for alcohol consumption, along with the facilitators to maintaining help-seeking behaviours. So, together, my findings will provide knowledge to help impact health promotion and policy in the future in hopes to gain more attention among midlife men in Australia, which will hopefully continue this decline of midlife men's risky drinking behaviours and contribute to positive health outcomes. Thank you very much.